My name is Toby Rogers. I'm an interventional cardiologist based in Washington, D.C. in the United States. I'm an associate professor for cardiology at Georgetown University and the scientific lead for structural heart disease at MedStar Washington Hospital Center. So at CRT 2022 this year, I'm presenting as a late-breaking clinical trial the results of the early feasibility study for the transmural systems transcatheter mitral cerclage ventriculoplasty. This is a device that is implanted entirely on the right side of the heart and performs at the same time a mitral annuloplasty and ventriculoplasty, so changes the geometry of the left ventricle. It's a fully percutaneous device, it's fully reversible, it's implanted almost entirely with fluoroscopy, and it is targeted to treat patients with heart failure and reduced ejection fraction and mild, moderate, and severe mitral regurgitation. We also tested the device in the trial in patients with heart failure and preserved ejection fraction. So typically it's the patients with atrial functional mitral regurgitation. Those patients had more significant MR as required by the protocol. So this was an early feasibility study focused primarily on testing safety, but with also, of course, some exploratory endpoints to test effectiveness of this device in those two patient subgroups. So it's a device that's implanted through the right internal jugular vein. The procedure is guided, as I mentioned, almost entirely by fluoroscopy. The course of the device, the trajectory that we follow for the device is from the internal jugular vein, we go into the coronary sinus, then identify a septal perforator vein, navigate through the septal myocardium and re-enter the RVOT. And then from the RVOT, we capture the crossing wire, externalize it through the tricuspid valve, and that completes the loop. So once we have that trajectory established, we then exchange the traversal catheters and guide wires that we use that are simple PCI microcatheters and coronary guide wires. We exchange them for a permanent implant that incorporates a tether and then a Y-shaped, wishbone-shaped lock that sits within the right atrium. The device, because it runs through the coronary sinus, in many patients will run over a branch of the circumflex artery. And so the device incorporates a rigid bridge shape element that we position using fluoroscopy over the circumflex so that as the device is tensioned down to affect the geometric result that we seek, it doesn't cause compression or occlusion of the entrapped circumflex.